You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you, everybody, and tuning back into us. And I certainly want to thank everybody from Business Radio X who's producing this live HIMSS19 segment of This Just In Radio Show. I'm your host, Justin Barnes. Have a seat, my friend. We'll talk some fun best practices, strategies. We're live on air right now. Howard Burde from Burde Health Law. But I have to give you some big props, not just that you're an amazing lawyer. However, you are this is the brainchild of you. The HIMSS Radio was you calling me saying, hey, we are doing the Venture Plus. This is in 2015. You said, Justin, we're doing the Venture Plus Forum, and can you think about bringing your radio show to Chicago and broadcast live? And Lee and Stone and I.
Yeah. Yes, we did.
Yeah, and Stone and I went out there, and that was my very first broadcast live for 2 hours. We're talking about it this morning.
You'd have never known it. You did a fantastic job, but I know your secret. You have great guests.
Exactly. It makes it easier.
And people were fighting to get on the radio with you. I mean, that was really the amazing part.
Yeah, it's cool.
Not that I should be amazed.
Hey, I'm blessed. I'm very fortunate, but that was a lot of fun. So thank you for that great idea, by the way.
Well, I mean... It was your idea to have the radio show. It was simply,
Actually, it was Roberta Mullen. I want to give Roberta. So she pitched it to me after my last company. She pitched, hey, we want to give you actually a radio show, and then a couple people stepped up to help underwrite it, and it was an amazing opportunity. So that is my idea. I'm not that smart. I just get up here and just talk.
You've done well.
Guys, right, but you guys always give me the great things, and Puneet, who's coming up next, you guys give me great ideas, and having great guests make it great.
And I dressed up for the radio, so you're really good about it.
Amen. But seriously, this was your idea back in 2015 to come to HIMSS and broadcast live. And we did it, and now it's now I got the biggest lineup of the conference, and so I feel very blessed, part of it, and thankful, and I want to make sure I give you proper props. But you were also our attorney 15 years ago, Blank Rome, right? You were with Blank Rome at the time.
Many years ago.
Many moons ago.
Many years ago.
Yes. And that's how I first met you. Sorry, I take my ginkgo biloba, so I remember all those crazy things.
Yeah.
But
yes.
I truly appreciate your partnership. I'm looking very forward to your dinner on Wednesday evening. Do we have a location? Oh, we probably should say that live on air.
What? The dinner? We're not going to say where it is. Because I'm not buying for everybody.
Exactly, but it's great. We actually have 30,000 people listening right now. Yes. But anyhow, let's dive into some of before we dive into the trends that we want to talk about, what do you hope to get out of HIMSS over the next couple of days? I always love, you've been going to HIMSS for a very long time like me. I love to hear your ideas and your thoughts.
And this may sound odd, especially for somebody who's talking on the radio. I come here to listen. And what I leave with is different perspectives on either things that I'm doing or things I'm thinking about. And I think some of that will be reflected today.
And
in this conversation, I hope.
It's next.
You work effectively on your own platform, so do I.
Yep.
And even working with clients, you don't often get the range of perspectives. And frankly, even those lawyers, accountants, consultants who work in big organizations don't get the value of multiple and extensive opinions.
Yes.
And this is an opportunity to listen, which of course makes terrible radio. But we'll
it makes great for radio for them, not for us. Right. Exactly. That's a common theme when I ask that question. Is just the collaboration. We get to learn because we go back and we're leaders in our communities, but we come here and everybody here, a lot of us are leaders here, and we learn from each other, which is awesome. We go here to get it. We become sharper here, steel sharpens steel, and so we come here and we get to collaborate and learn. And I agree. I listen as much as possible. I talk too much, way too much, but I actually don't have to.
You're on the radio. You have to.
Correct. But I actually talk only probably 1% or 10% of the time. My guests talk 90% of the time, and so I'm always learning learning. People say,
actually, I dropped my notes here.
Oh, please get your notes.
There we go.
But people say, why do you do the radio show? I'm like, well, because it's free. It's free consulting. I get to learn all this stuff from all my guests. It's amazing. It's like an MBA program every single week. So you know what? You have 3 children in Ivy League schools, correct? So you know the cost of education?
One is at Duke and one is at Penn. And
You've always told me Duke was Ivy League. You've told me that all the way along.
No, it's not in the Ivy League. It's in the ACC. You're in Atlanta. You know that.
Kidding. No, I know you're a Duke guy, though, right?
Yes.
Yes, I figured. I was joking. So tell me about what healthcare, health IT trends do you see in the industry or that you're navigating?
Well, I think that, and part of this is getting the perspective that we gain here, but I would focus on the development of communities or the accessing and use of communities.
Mm-hmm.
We can bring down healthcare costs and improve healthcare quality by focusing on existing relationships, existing communities. Now, I know this sounds a lot like managed care. Well, it is. When you define a community and define the benefits, you can control the costs and increase the quality. Yeah. That's not a secret.
Right.
The fact that it became roundly condemned because it was often very badly done.
Correct. The idea was good. The implementation was terrible in some ways.
And bad enough by enough people that we ended up losing it.
Yep.
But if you look at Hip Nation or Activate Healthcare, or even what's going on with Amazon Berkshire Hathaway,
for sure,
where they're taking a captive population of 1.3 million or so lives and offering discrete benefits.
Yeah.
They're going to reduce costs, and because they have
by
the
30%.
Market, by 30%.
Yeah.
And they can demand better quality. They can use metrics to increase the quality. So I think that's, if there's one thing to take out of this, and if I were starting a company, I'd say focus on how to serve those markets.
Amen, yes.
That's one thing. The other, and this got a great deal of attention at the end, the fourth quarter of 2018, but it's a persistent issue, and that's security. I talk to investors about this. I talk to my clients that are solution providers. Follow the guidance from HHS.
Right.
It doesn't make you safe, but it makes the investment safer.
Yep.
Nobody is really safe.
At least Anthony was my guest right before you from ONC HHS. That's who was right in that scene. Oh, no, Chris Fowler was right before you, right?
Before me.
Yeah, but Elise was right before that. So you're preaching.
I mean,
it's
it's
great.
just,
I love it.
I cannot tell you how disruptive it is.
Right.
When an intrusion occurs, and it doesn't matter whose fault it is.
That's right. It does
or
not.
if it's nobody's fault.
That's right. Yeah.
And I will also tell you that almost no investors that I speak with do anything except take it for granted instead of exploring it on the front end. And that, I think, is a mistake, but it's not my money.
Right. Nope, agree. So what are 2 or 3 best practices that you can offer to successfully navigate those trends or strategies that you just mentioned?
Well, I think the first is to focus on not necessarily, there's a lot of noise and a lot of publication out there. What is the underlying theory behind, for example, the provision of employer or union-based care, or the Amazon Berkshire Hathaway? I mean, we can talk about it, but nobody's talking about it in terms of defined and captive populations and defined and captive benefits, which is all they are.
Yeah, it's very true.
And if you look at that, then, all right, what aspects of that business become important? Do, for example, communication solutions become really important in that aspect? Right? And I'm not sure they do, but just about every one of those kinds of providers has a communication system.
Yes.
Whether it's Twine or LifeWire, which the VA uses, or any of the innumerable others. Twine, by the way, was bought by Fitbit. So they're out there. Who serves those populations and serves them well? And, by the way, while we don't like to look at it this way for political reasons, neither Republican nor Democrat, but the fact is association health plans if you call them something else, are nothing more or less than just what we're talking about.
Correct.
Defined existing populations. You're actually serving people where they live with their self-selected groups.
Yep.
And so I think that's something that we should look at. That's a real future.
That's excellent. So, I agree. No, it's fantastic. No, and actually, I'm navigating association health plans pretty significantly now, just because.
I know I was giving you props. But I happen to believe it.
Yes, awesome. I can tell. So now, thinking beyond, HIMSS is about the here and now. What's happening in 2019? What's happening in 2020? But think about 2022. What should we be keeping our eye on from your perspective? Either that you are, or you said that we should keep our eye on, and think about innovation, technology, policy, where health's going to be, healthcare is going to be. What are you thinking there?
2022 is both a lot further and a lot closer than we think.
I was going to say the same thing. So true.
And the thing to focus on any date that distant is focus on fundamentals.
Yep.
How is care provided?
Yes.
How is it paid for? If you're looking for something that is growing now and will be out there then, look at the things I've talked about.
Yes.
And also look at transportation. Because if you examine the provision of care and the provision of services to underserved populations, the big issue is often not access to, is not the availability of care, it's the access of care.
Yeah.
Which is why you get
they have an appointment.
Health.
They just can't get there to that to that appointment. Yeah,
that's right. And it's no longer ambulances serving them.
Yeah, correct.
So managed care plans such as AmeriHealth Caritas and Centene and others have contracts just to get their members from one place to care, which again goes to the question of, well, gee, why aren't they part of an association or other group so they can get the care where they are?
That's right.
But another set of circumstances that probably are outside the realm of healthcare.
It's excellent. So as we wrap up here, what are you looking forward to the next day or two? Anything specific other than the big dinner we have tomorrow night?
Other than dinner with Justin once a year, which is
that's great.
That's great, and 8 of our closest friends,
Amen,
which is always great.
A lot of fun. What are you looking forward to? Yeah.
Well, the venture program tomorrow.
Oh, that's right. Yes.
And that's great, not just because there are terrific panels, which there are. We have 8 well-vetted, curated companies presenting, and the number has changed over the years. It's gone from 20 down to 4, back up to 8. I would always prefer more, but you see really terrific companies that have learned how to present, that have interesting new solutions, and I think that's great.
Yep.
The other thing I'm going to be looking for is more on the services side, because the technology is great, but technologies have to serve services in order to get to the patients.
Yep.
So that's what I'm looking forward to.
I love it. How many? How big is tomorrow? How many investors do you have, or entrepreneurs and all that in the room? More than
I
ever,
have
right?
to stand up now. You're getting rid of me. Okay. It's fine.
My next guest right here.
Right. And this is another wonderful thing. We started this. This is the 14th year of the venture program.
Yeah.
The first year, we had 60 people in the room, including the presenting companies. This year, they capped it after extending it at 725.
Wow.
So the program has really grown. The people from Health 2.0 do a spectacular job with it.
Yeah.
I mean, remember, this was something I would do in my spare time, and now they have a whole professional staff, which is wonderful because any one of them is more competent at it than I was in my spare time, and they're really terrific, and I'm pleased to remain a part of it.
Yeah, it's a great program.
Thank you, Justin.
Howard Berg, thank you very much, my friend. Jennifer Reneker,
Yes.
Associate Professor and Coordinator of Research from the University of Mississippi Medical Center.
Yes.
So that's a mouthful.
Yes.
Excellent. So is this how many HIMSS have you been to? Is this your first one?
This is my first one. Yeah.
Very cool.
So it's a little overwhelming. I got lost earlier today in this room, and I thought I would never find my way out.
Oh, yeah. And it actually gets busier than this, too. I think there's between 42 and 45,000 people here. I don't know where the official count will come in.
Okay.
But certainly the largest show. This is I think it's my 18th year coming to HIMSS, but and every year it grows. It's a lot of fun, but welcome. I'm glad you're here.
Thank you. Thank you very much.
Very cool. So what do you hope to get out of you're showing, we'll talk about that in a moment here, some of the trends, but you're here discussing some of your augmented reality and your virtual reality?
Right. So we have a virtual reality game that we actually have here in one of the Lenovo headsets, and it is a game to train your peripheral vision to make your vision on the side better. Oh. And we're actually doing research and innovation in concussion rehab and prevention related to that and other games. Yeah.
Excellent. So diving in, what are the trends that you're seeing out there on the healthcare and the health IT side that you're navigating?
So I've been listening to your radio show and it's been wonderful, but I'm very myopic compared to these big thinkers that are.
Well, we have everybody. Yes.
So I'm very interested in brain health, and what I see is the trend is. We've really recognized that your eye movements and being able to understand, capture, and see your eye movements very precisely can diagnose a lot of brain health problems, concussion being one of them. Yes. And so the technology enabling that I think that's coming on the front line here is really using the virtual reality device and the potential for eye tracking to capture eye movements that we haven't been able to capture in other ways.
I love it. That's fascinating. So what are, say, 2 or 3 best practices to navigate that, or how do you engage that? How would you tell my audience and how you do it?
So I think one thing is true, and a couple people have alluded to this, that you really have to be careful about the apps that you get involved with, because you never know if it's just a dud. So I would say, look to see if there's research to support what it is that you're getting into. Also, pay attention to what the FDA is approving, and then find the people who are early adopters, the innovators, the early adopters, and then see how it's working for them before you make a huge investment.
That's excellent. So tell me about how'd you come across this? Because I remember when I was talking to you before we went on air, even last week or 2 weeks ago, you mentioned you kind of stumbled across this a little bit. So how did you put all this together?
Well, so I am a vestibular rehabilitation specialist, and I've been doing research in this area for quite some time.
You are the first vestibular rehabilitation specialist I've ever had on the show.
Oh, I so
love
honored.
It.
But in May of 2018, I'd been working on this preventative intervention for preventing concussion in collegiate athletes, and I actually met a metaverse curator, which is a very fancy way of saying a software developer, and he introduced me to the world of VR. And whenever it's for gaming, it's for sensory immersion, and I'm not a gamer, but all I could think about is, can we use this technology to do something to rehabilitate from or prevent concussion? And so it was by accident that I stumbled into this.
That's so cool, though. And now you're talking about 7-8 months later, you're here showing it to thousands and thousands of people.
Correct.
And talking about it on air to 30,000 people.
That's right.
That's very cool. So tell me, as you heard, I like to talk here and now. We talk about a lot the here and now, but also thinking 3 years from now. What do you see, or where do you see this evolving to? I mean, are we going to be able to cure certain things, look for issues, then find cures for those issues, help CTE,
Yeah. But, well, I think for me personally, where I see it going and what's very exciting is the potential to think about integrating virtual reality or augmented reality with telehealth, because there's this magical space in the metaverse where you could meet up with your patients as a healthcare provider. And this offers the opportunity to possibly have synchronous or asynchronous care and to interact with patients in a new way. I also really think that rehabilitation professionals like myself are going to be able to see these tools of the virtual environment be very motivating for especially younger patients or athletes. And so I think that you're going to see this come on with a lot of rehabilitative tools that are very useful and very effective.
Have you engaged the NFL at all around this, or will you? Do you plan this on or even high schools?
Yeah, so right now I've been doing research with college athletes, and I have a couple studies that are going to be published here soon. The first one was integrating virtual reality as prevention for injury, and when we were actually able to show a 27% reduction in the number of injuries comparing the 18 season back to the 2017 season when they didn't have this. So that's great preliminary data, and yes, the plan is to hopefully engage the NFL. Mm-hmm.
Yeah, because technically you could even, I'm thinking maybe ahead or where you're going, but you could put this headset on literally on a side of after a big hit on the sidelines.
Potentially.
And you could it could diagnose it there, or always begin to say, hey, yes, there's some initial issues here. We shouldn't certainly put him back in the game, because right now it's very arbitrary.
Yes, absolutely.
It's extremely arbitrary.
Absolutely.
Yeah.
So I think there's a lot that could be done on that
and if
front.
there's AI or machine learning or in somewhere in there where it's not someone who's under pressure to put them back in the game, because that's what a lot of these sideline doctors are.
Right.
They say they're not, but they are.
Yes.
We say, oh no, it just showed red. He's not going back in the game, or she's not going back in the game.
Yes.
That's fantastic. So what do you hope over the next 2 days of HIMSS? What do you hope to accomplish? What are your goals?
Well, I'm hoping to gauge interest in what it is that we're showing, and kind of just to put it out there, because thinking about training inside of VR, like therapeutic training inside of VR, is a very new concept. And so I'm really interested in finding out what people think about that, if they have questions for me. And then also to just learn other things that are out here, because it took one exposure to VR in May, and so heaven only knows I may meet you and then be doing something else in addition.
Yeah, no, actually you should. So the this whole discussion around concussion protocols just came to full light. I don't know if you saw the interview with Bob Costas or his note from 2 days ago.
I did not.
He literally was pulled from the coverage of from the Super Bowl last year, because he was talking about concussions in the game, and they didn't appreciate that, and so they actually pulled Bob Costas off the air. And he didn't say that last year. He was just saying, we had scheduling conflicts, and so I couldn't do the Super Bowl. I couldn't announce the Super Bowl. But about 2 weeks ago, after this last Super Bowl, or 5 days ago, he came out and said, they actually pulled me. CBS pulled me because NBC pulled me from my coverage. Because I talked too much about the concussion, and I was relating it too much to the football. And so you might actually have something in common with Bob Costas at some point.
Well, that's interesting.
He's very passionate about this right now.
Yes, that's fantastic. That's good to know.
It. Very cool. Well, Jennifer, I'm glad you could join the show very much, and congratulations, and welcome to HIMSS again.
Thank you so much, Justin.
Thank you. Awesome. So, Rasu Shrestha, so you're new, actually, tell us about your new role really quick, because you're now EVP and Chief Strategy Officer for Atrium Health in North Carolina.
So, as you know, I was the Chief Innovation Officer at UPMC. I was there for 12 years, and I recently made the move. This is day 10 for me in my new role as Chief Strategy Officer at Atrium Health, which is the old Carolina's healthcare system. 50 hospitals across North and South Carolina, and now expanding into Georgia and broader as well. So, really excited. Yeah.
Very cool. So I know you have a tight schedule too, so I'll jump right in. What healthcare and health IT trends are you seeing out in the industry and that you're navigating? Certainly in your new role even.
It's really interesting. And in the 10 days that I've been there, the observations that I've made. No, but more generally speaking,
for sure.
Okay, right? When you look at some of the trends that are out there, and we're at a HIMSS conference with 45,000 of our closest friends, there are a lot of buzzwords out there, right?
Yep.
What I'm really after are specific elements of how capabilities like artificial intelligence are really making impact where impact matters the most, right? So it's specifically around areas, for example, around physician burnout. How do we make sure that we're able to decipher the signal from the noise, make it easier for physicians and clinicians in general to navigate the mundaneness of actually providing care, and let machines do the jobs that machines are really good at doing, and number crunching and data crunching and decision support, so that it augments the care that we're providing. And I think so that's one example. The other example really is, and this is what I'm really excited about too, is how do we have impact across the communities that we're actually serving, right? So when you talk about the intersection of personalized medicine with public health and population health, sort of the 3 Ps coming together around that N of 1 that happens to reside in a certain community, how do we make sure that we're able to leverage the power of data to really influence behavior in that person that is not just a patient, but really a consumer, a participant in the care of that individual. So really excited about that too.
I love it. So what are 2 or 3 best practices that you can offer to navigate some of those trends?
So clearly there's a lot of complexities in the delivery of healthcare, right? I mean, healthcare, when you think about this, is such a complex thing. We're inundated with complexity in healthcare. Complexity is the bane of our existence in healthcare.
It is. We make it more complex sometimes too.
But participatory design thinking, I think, is the cure. So if there was one thing that I'd really push for, it's how do we get to a state of participatory design thinking? Meaning, how do we engage end users, patients, clinicians, and others in the very design of the solutions that we are then going to put in front of them? Not just in a once and done and for formality, hey, we've got the patient in a panel and we have a, no. how do we do this in an iterative, continuous way such that we're able to fail fast and succeed often and then scale those successes to a way that we can really impact change?
I love it. You just mentioned 3 things that actually came out in our last think tank. That was just perfect. So you just hit on all 3 of them. First of all, physicians are starting to accept, and I was actually surprised. You're a physician, so you probably weren't as much as I was, but they're actually accepting AI in care design and care planning. And so I wouldn't think that necessarily, because usually the doctor wanted to control a lot of that, but they're actually welcoming AI. They want to be trained on how to use artificial intelligence in their care strategy. That was pretty phenomenal. That came out, but also how to get, and best practices to get physicians engaged in the design that you just mentioned. So I think that's spot on as well. But thinking a little bit further ahead, in the next 2 to 3 years, kind of like what Wayne Gretzky, where the puck is going to be, what do we need to be thinking about? We're here, we're at HIMSS, we're here and now, we see a lot of stuff, AI certainly now and in the future, but what do you think we need to be thinking about that we maybe haven't thought about yet?
So it's really interesting. There are lots of things coming at us, right?
Yes.
And lots of really interesting, shiny objects that we could be going after and completely lose our way because, oh my goodness, nothing, that was nothing. Okay. The one thing that I'm really excited about is the advent of consumerization mixing together with genomics, right?
Yes.
So when you look at the rise of the consumer in genomics and genetics and how they're engaging themselves in looking at their own DNA makeup and their biomarkers, what works more versus less. And this is not just the Christmas present that you got in terms of a 23andMe bio that you can spit into. And,
sure.
And
that's
important.
a start.
I think that's a start. And
that,
and color genomics is doing some really remarkable things in that realm. But it's really then marrying that data, those insights, with the specifics of who you are as a human being, marrying it then with the specifics of your preferences and your social determinants and where you live and where. So I think that continuum of where you're liberating the data that defines the genomics, marrying it with the phenotypic information of who you are as a human being, and then it all coming together in a way that actually warrants behavior change in a positive way. So we're moving the conversation from just managing illness to us really talking about managing wellness, moving from survival to managing to actually going to thrival. So that's what I'm really excited about.
I love it. So in closing, I got 2 minutes. I saw something out there where I think you're traveling. You talk about unlearning. Talk about that for 2 minutes. I think it's really important. When I heard you mention that, it resonated in my head.
So it's really interesting, I'm a lifelong scholar, as you are as well, and we're always learning through the hard knocks school of life and through conferences like this, and we're reading books and we're looking at best practices, and we talk about all of these different elements of how do we continually improve ourselves, how do we continue to push the needle forward, have our foot on the gas pedal and continue to learn and continue to grow. And I think that's innate to who we are as human beings, as learning organizations. That's really important. But the one element that we just have not gotten right just yet, I think, is this element of unlearning. I think it's really important for us to unlearn.
Yeah.
It's important for us to pause and reflect and really look at where it is that we are. Because even if some of the learnings were based on strong science and academic rigor and evidence-based guidelines, the reality is that the environments around you, the multiple factors around you keep on changing. So I think it's really important for us to pause, reflect, and figure out what's working and what's not.
Yeah.
What are some old paradigms that I actually have to throw out the window?
You gotta get rid of them,
such that I can then build these newer ways of caring for people, newer ways of looking at data, newer ways of collaboration, and moving forward. So the challenge that I put out to people all the time is, what will you unlearn today?
Yeah. I love it. No, you're spot on. I knew when I heard it, it resonated with me, and that's just a standard good business best practice, but certainly from your standard here and how to lead the industry and how to help people really thrive, I love it. So, Rasu, thank you very much. And for everyone listening, thank you for joining us today, and please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustIn so you can respond to your comments from this show. In addition, all my content's always posted on my website at justinbarnes.com. Thanks, everyone. Have a terrific week.